Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today on the show, we welcome Liudmila Schafer. She's a board-certified medical oncologist, and she's the author of the book, The Other Side of Oncology. She's also CEO of The Doctor Connect. It's a consultancy specializing in helping physicians unlock their full potential for passion-driven business and media appearances. She's going to talk about her Kevin MD article, the pros and cons of using ChatGPT for your healthcare needs. Liudmila, welcome to the show.
Oh, Kevin, thank you very much for having me.
So we'll get into your article in a little bit, but first off, just briefly share your story and journey to where you are today.
I'm very grateful, Kevin, for what you're doing and actually providing platform for our physicians and for us physicians, because definitely our voices have not been heard. Let me take you back early in 2000 when I actually finished medical school and did my residency and fellowship back in Europe. And then 25 years ago, I did a bold step and I moved to the United States. I had to repeat another residency and fellowship because it's required in order to practice as a physician, as we all know. And then pretty much practiced all my life as academic physician, did clinical research and was as a faculty. And initially, my story goes back when I was 5 years old. And when I grew up, we basically raised all food ourselves, vegetables and fruits, and helped parents and grew up on a farm. And back in Europe, I was born on the border of Poland and Belarus. After I graduated, it was very limited resources, and I really was not that many, opportunities to practice as a physician. So that kind of, made me to make this bold step and move over here. So when I arrived to the United States, I didn't have really money, no real support, had a young son and had started everything from scratch. So moving forward, now when my dad passed away in August 2021, I was flying back from funeral. And then sitting at the gate, I basically start reflecting and thinking everything back in my life and how we all go through training, residency, fellowship. And I felt that I actually wanted to teach and share my knowledge outside one patient room. And we all know it was exactly at the time of pandemic, but it really already was boiling in me for the last several years, because I feel that academic institutions feel small physicians and lack a little bit of our passion.
So you are the founder of a medical consultancy I'm interested in hearing. And it says here, you help physicians unlock their full potential for passion-driven business and media appearances. Why is it important for physicians to have their voices heard outside the exam room in media appearances, for instance?
Yeah, I feel, Kevin, that physician voices have not been heard. And what happened that every time when we go, we speak most of the time about our expertise. We speak at our national meetings, let's say American College Physician, American Society of Clinical Oncology. But it's not a lot of physicians actually speak on the media. You have to be really A+ media person in order for reporters and journalists invite you, because physicians speak in complicated terminology. We don't come across with specific message. Many of us don't know how to approach reporters because they also want to have a very positive and right guest, because how media done. And when they invited me to speak on Fox News about pancreatic cancer and colorectal cancer, it happened in fall also 2021, then the reporter all of a sudden started asking me about my story. So I shared that then when I was 5 years old, I drowned. And then later, 30 years forward, I actually became an advanced open water diver. So then I started sharing my story. Next thing you know, more media reached out and people wanted to work with me. So that's how the Doctor Connect was born. So I started initially from, patients. And then when I was working with coaches, I figured out that it's a lot of people teaching about cardiology, pulmonology, heart disease, diabetes, cancer in my situation. And it was not really expertise that we would actually really do in practice as evidence-based. So that is why I shifted purely toward board-certified physicians and help them to discover not only how they can present themselves with expertise, but also marry their passion. Because many physicians, as I found out, actually hide their passion inside. And unless it's burnout, unless it's maybe family death or some crucial situation, we don't actually come out. So that's why I really advocate that marrying your passion and expertise as a physician, we can discover brand, present as a theme with a strategically structured brand narrative within 60 seconds. So then market will see as expert and you can share your knowledge outside one patient room.
I'd love to get you back on the show and talk more about how physicians can be more comfortable in the media. But today I'm going to talk about your Kevin MD article. You talk about ChatGPT, the pros and cons of using it for your health care needs. And for those, of course, who aren't familiar with ChatGPT, it was released in November by OpenAI. It's what's called a large language model. Everyone has been using it, but I am certainly interested in hearing your perspective, how that intersects with healthcare. So talk about how your article came together.
When I was working before at the previous institution, and even right now we use a platform putting chemotherapy orders, and for one patient, it requires 50 to 55 clicks actually to put one patient order. So when I started sharing about this, and then we realized we actually have AI, and ChatGPT, it's only probably drop in the ocean among all other platforms that coming up probably for the next 5 to 10 years. Yeah. So with ChatGPT, as I see patients every day. I still practice as a medical oncologist, my specialty in GI oncology. But since I developed consultancy of the Doctor Connect, now I do contract the medical oncologist. Patients bring information and they actually pull and they tell, well, Dr. Schafer, but Dr. Google said this. And then someone was actually speaking how to treat thrombocytopenia. So for all of us, your audience knows that it's a low platelet count, and they pull and they brought me differential diagnosis. So I started exploring and I put in ChatGPT, how do you treat pancreatic cancer? So it came up with a not good answer. So we learned that it's incorporate not only that we see every day when we encounter patients, it takes more from patient encounter. I have to waste more time with the patient and explain that it's not exactly what's there in Dr. Google or ChatGPT or other platforms, that we actually have other evidence-based information. And I really feel that we need to bring a little bit more awareness, because now ChatGPT will be incorporated in some platforms, as I heard, Epic. There are some other platforms. There are some physicians advocate, and well, of course, it's a lot of positive. We can save on radiology images. We can save maybe writing grants. We can maybe, type or dictate something. But then on the other side, how about malpractice? I've heard that also, and I don't know if it's true, for full disclosure, who is listening to me, the American Bar Association might be looking at this as a part of malpractice. So that's why I felt that bringing pros and cons of ChatGPT is important and elevate voices about other AI platforms in the future.
So tell me, you mentioned one example of how ChatGPT intersected with your practice. So are you seeing patients come to you with information that they asked the AI and asking you what you thought about it?
Absolutely, Kevin. And in the past, patients used to bring articles. And now, in addition to articles, they incorporate AI and do ask. And, that's why there was actually one of the reasons why not only in my situation, but maybe for other subspecialty, as you probably know, I also do a show once a month on PC15. So I try to see how we can elevate, voices of physicians.
So how else are you using ChatGPT from the clinic side? You mentioned that it helps sometimes with orders. How else are you using it today?
In the clinic, Kevin, I do not use, and it's not, incorporated, but patients bring that.
Okay.
So I use ChatGPT, for example, with an idea. If I want to, let's say, speak with some physician, and that physician will tell me that he likes to climb mountains. So maybe I know very little about climbing mountains because, I'm scuba diver. So then I incorporate and maybe I pull some points. So I feel that this data generated, it's not where we actually in the clinics today. I think it's a way more evidence-based, and it would require way more platforms for us, like legitimate, implement in the clinic. But I think some specialties it will be replaced fairly soon for the next 5-7 years.
Now, what example do you speculate? Which specialties do you think would be most impacted by the rise of generative AI?
Yeah, we have to be very careful because obviously I don't do any programming and I don't write, but even maybe read images. That's one in terms of radiology, and we love radiologists, but they also overworked and stressed out. So we need to help them. Maybe writing certain NCI designated grant and maybe do certain reports. There are some subspecialty reading, incorporating for next generation sequence and maybe collecting data and see what's, clinical information. Because with the new platforms, molecular platforms, as oncology is one of the fast, most dynamic evolving field, right now, even a lot of oncologists have a difficult time to read next generation sequence and help with the clinical trials.
So what area, it doesn't have to be oncology, but what area of medicine do you think these AI systems have the most promise and going to impact your life most directly?
Impact in my life, it
Yeah.
would be definitely the pathology reports
Okay.
and collecting stages and collecting all molecular alterations, as well as generate much better clinical trials with the data driven. Still find certain articles if we want to incorporate something from molecular platforms. It takes manpower in the clinic to find this information.
Now, for the patients who are using ChatGPT, and I see this all over social media on TikTok and Instagram, what kind of advice do you have for patients who are using ChatGPT to answer healthcare questions?
To ask the doctor the question in a phrase of, would it be valuable? And then bring that information in advance. So instead of taking time during very busy appointment that we have about 15-20 minutes per patient and sometimes overbooked, if we get this information in advance, we could screen during the same day or the same time. And as we know right now, a lot of notes being shared with patients since new regulations came in 2021, prepare that information. So maybe they can send early to the clinic. So then we screen and have specific answer for the patient in advance and evaluate and use this time during appointment to physical exam and discuss more important options for diagnosis and treatment.
One of the things I read about the cautions of these AI platforms is the data, right? Because it's only as good as the data that it collects. And sometimes if we put in patient information, things that are pretty sensitive, we're not sure what happens to that data. So talk about that privacy component to generative AI, because I think sometimes that's been overlooked in the discussion.
Kevin, I think it's several aspects. One is breach security. And I think cybersecurity and insurance definitely would be taken a completely different branch. Second, just like we use for clinical trials, incorporation of this data security, we used to put, it's just the passcode, it's just one computer, but now we are talking about have actually not just hyperspace, but a hyper cloud. So as far as I know, some of this information will not be only stored in one individual computer, but also it will be in the cloud. So how we protect the cloud, that's one aspect. And on the other aspect, who is going to be responsible if anything would be learned from ChatGPT or AI platform and then generated, and ultimately, physicians not very much protected from malpractice. So I think the next step may be to take to the Congress and look at this.
So let's say I talk to you next year and generative AI, it's been progressing so fast. So this time next year, what is your prediction of what will happen to that intersection between AI and medicine?
Probably it will be incorporation of more and more of AI on everyday clinical practice. The question is it the only ChatGPT? It's probably coming hundreds of other platforms that we don't even know right now.
Mm-hmm.
And it's, like I said, it's only one drop in the ocean. So which one will be better? And maybe some platforms will be more applicable for one discipline versus another discipline. So just because we hear about this on the media and it's more, popular, it might not be most applicable for a certain discipline. So that's to identify maybe one of the important things that we can be on lookup.
We're talking to Liudmila Schafer. She's a board-certified medical oncologist, and her Kevin MD article is titled "The Pros and Cons of Using ChatGPT for Your Healthcare Needs." So tell us some of your take-home messages that you want to leave with the Kevin MD audience.
Thank you, Kevin, for such a great interview, and you ask such great questions. One of these that traditional medicine is overrated, and each physician has passion and expertise. I wish we would have more voices, that we physicians go on, TEDx and write more books and be a little bit more defined rather than label us. And also explore, what else you can do with the resources, with your expertise, and know that there are peers out there, peers like you, who does such a valuable work spreading our voice and helping us. So thank you.
Liudmila, thank you so much for sharing your story, time, and insight. And thanks again for being on the show.
Thank you very much, Kevin, for having me.